Dr. Tom Frieden is the director of the Centers for Disease Control, the government's top point person on all of this, and he joins me now for the latest. So local officials are saying that there is a possibility that a second person, is that confirmed?
Absolutely not. We're in the early stages of the investigation. This is going to be a very intensive set of work. Today, our team on the ground interviewed about 100 workers at the hospital to really parse out, were people exposed, and if so, how, so that we can make sure that we have a roster of everyone who is exposed and then track each one of them for 21 days to see if they become ill.
Okay, so tracking is not the same as quarantining. You said, for example, while we were watching the videotape there, that those ambulance workers are not under quarantine now?
The details really have to be worked out locally. Our general approach is to say if someone's been exposed, they need to check their temperature twice a day. We would check their temperature at least once a day. And then if there are any symptoms at all, they need to be isolated immediately. But the bottom line here is that we know how to stop Ebola. We have two things in this country that they don't have and they need in West Africa. One is good infection control in healthcare facilities so it doesn't spread there. And the second is good core, tried and true public health. Find contacts, trace them, monitor them. If they're sick, isolate them. You do those two things, you can stop Ebola, and that's what I'm confident will happen here.
And so also about those 5 children that were reported to have had contact with the person that's infected. Any idea how we monitor that and all the people that those children might touch?
Very important point to be clear about. If someone is exposed to a person with Ebola, they cannot spread it to others unless they get sick and until they get sick. So even if you've been exposed, if you're not sick, you're not shedding the virus, you can't make other people sick.
Okay, so one of the things that we've been hearing consistently is that there is this travel that's happening outside of countries, outside of West Africa. Why not? There's a bunch of questions that we had on Facebook. Why do they continue to let people travel back and forth? Shouldn't there be restrictions at least until this situation is under control in Africa? That came from Anne-Marie Casey on our Facebook page. How do you control it?
Well, first off, months ago, we recommended that Americans restrict non-essential travel. But paradoxically, if we're to isolate the country from others, that's actually going to increase risk to the rest of the world. You have to think it through for a minute. To get there, you have to fly. To fly, you have to have airlines going and coming back. If people there feel that they're isolated from the rest of the world, they'll leave more. So both within countries and between countries, if we try to seal borders, we're going to do more harm than good. We're going to spread the disease more than we stop spread of it. This is something that's very important to understand. It's crucial to isolate patients, but isolating communities or countries is counterproductive.
And when you've isolated this patient now that's in the U.S., and as you've increased the kind of depth of your dive on who he's touched, what are pieces of information that you've learned now?
Well, it'll be days as we interview others and follow and get more information till we know how many people really might have been exposed. We take kind of a concentric circle approach. Who are those who really did have a lot of contact, who are going to need to be very careful to monitor? Who are those who might have just had the slightest of contacts, but out of an abundance of caution, we're going to also monitor. That's something that we'll be sorting through over the next day or two.
And what kind of treatment is he likely to get?
Well, it turns out that for Ebola, even without experimental medicines, there's a lot that can be done just to improve the patient's outcome by providing fluids and balancing their electrolytes, that kind of intensive care that gets provided. We're really hoping for his recovery, but last we heard he was quite sick.
Okay, and we've heard that he might have come in contact with as many as 100 people. Is that true?
I've not heard that number. There are a lot of rumors
Right.
about cases, rumors about contacts. Let's take things one step at a time. What we know is we have one patient with Ebola in the U.S. He's being cared for in a hospital in isolation. We're going to identify who might have had contact with him, and we'll have that information over the next day or two.
Hey, given the kind of laws of probability and the number of people who are traveling on aircraft all over the world, is it statistically likely that there might be others, whether they're coming to the United States or elsewhere?
I think with what we're seeing in West Africa, with many thousands of cases, it is highly likely that we'll see Ebola in other parts of the world, particularly neighboring countries or other parts of Africa. Even if you were to stop flights, and that's not being done, but even if you were, people travel. They travel by various routes, overland, borders are porous, they have sometimes citizenship in multiple countries. So this idea that we can somehow seal it off is not going to work. We have to recognize that the way to keep ourselves safe is to help stop the outbreak there. That's the most effective. In fact, that's the only way that we're going to ensure that we're safe. So yes, we're going to do things here, but we've got to address the problems there.
All right, Dr. Tom Frieden, head of the CDC, thanks so much.
Thank you.